Hello everyone, this is Dr. Mohit and today we will be discussing about atopic dermatitis, a very specific topic related to dermatology, obviously, yes. And over here, first question I want to ask you is, what is the other name for this? I know you are listening this lecture to learn about it, but just an instance, if you know it, it's good, right? So atopic dermatitis, other name is eczema, right? Eczema. We read and we listen about this one word so many times. Today we're going to break everything down. Okay, so today I just want to use one analogy, right, of this wall, this image we have over here, right, this brick wall which we have here. As you can see, the bricks, and in between the bricks we have the cement layer, right? Cement, what is the use of cement, right? It is used to fixate all the bricks properly in line, yes. Okay, one question. What do you think if there will be a problem if the cement is not there or it is absent? Do you think the wall will be well structured or it could hold its place? Impossible, right? That is just not possible. Okay, second question. How do you think about the bricks? If the bricks are not there, so what is the cement gonna do? It can't do nothing. Yes, so they both need each other. So just like that, even in our skin, now I want you to keep this analogy for our skin. The bricks are the keratinocytes and the cement, right? The cement is the intercellular lipids. Yes, these are the intercellular lipids, the cement layer. Okay, all right. And in the eczema, in the atopic dermatitis, what happens is there is problem in the cement. Okay. Now just per se, the cement has some issues. Do you think the skin will be functioning normally, or what do you think will happen? The bricks will fall, right? And if the bricks fall, probably there will be the whole mayhem will start because of that. Okay, so intercellular lipids, that is the cement formation is not there. Yes, and who is responsible to make this cement are these guys. These are the lamellar bodies. All right, the lamellar bodies are the ones who are responsible for this, and these lamellar bodies are in the bricks, in the keratinocytes. All right, as simple as that. Okay, so I hope you get that analogy right. If you got that right, everything would be very clear, right? So the bricks are the keratinocytes, the intercellular lipids are the cement. Yes. And in eczema, in atopic dermatitis, what is happening is that there is problem in the cement and then the whole mayhem happens. Now let us see about the presentation and the problems in the patient. So now let us just see, right, if there is problem in the intercellular lipids, what is going to happen. But first we need to know what is there in it that is causing the problem. So if we know this, that what is there in the intercellular lipids, what's going to happen is we can, if we just give it from outside, well and good, the problem is solved, the patient goes home happy, right? So what are the constituents about for the intercellular lipids? So first of all, we have the ceramides, yes, and we have sequelins and the fatty acid. Alright, so over here, if you understand the whole thing, right, from the very beginning, what is happening is these three things which are there in the intercellular lipids, these are lost. In what condition? In eczema. That is the topic of discussion, that is the atopic dermatitis. Alright, so just imagine, right? So the cement is not there, so what's going to happen? There will be problem, right? Problem related to what? Think. There will be problem related to the barrier function, right? Because just the bricks are there, there's no cement, right? So the protective layer is gone. Yes, so anything which can come from outside can affect, right? So that is the reason. Yes, because the small gaps are created, we have the barrier function defect. in these patients. Okay, all right. What happened now is, because there is loss of these intercellular lipids, yes, now there is this gap. Now this gap is being filled by a fluid. Okay, now these gaps are being filled by fluid. Yes, that is the reason we have this spongiosis phenomena in these patients. Okay, now you got the concepts right. That is, there would be spongiosis, or we can say intercellular edema. So yes, we would see the histopathological image as well, right? But this term spongiosis is very important to us. Okay, all right. So far, if you know the history, yes, what is happening is, yes, okay, fine, there is problem in the semen, and the sequel and the ceramides are absent. Because of that, there is some space created, the barrier function is gone, and just because of that, we have the fluid accumulation and the cells are going under spongiosis, right? Okay, so far the story is very clear, crystal clear, right? And because of that, this thing happens, the fluid oozing out, right? The fluid oozing out of the skin. Yes, so this makes a very characteristic appearance. Yes, so this is a very characteristic sign in the patients of eczema, that is atopic dermatitis. Okay, and because of these gaps, you see, because of these gaps, what happens is, there is entry of microorganisms in atopic eczema, right? That is the reason the patients are exposed to reinfections again and again and again. Yes, okay. A very simple point over here. If the patient is having a barrier function because loss of ceramides, what is happening is there is free passage to microorganisms, and the offending organism would just straight away go into the skin. Yes, pretty simple. Yes, so that is all about that. How do you think what we should do the treatment? Yes, if you understood why this is happening, now to make you understand what we could do would be very simple. Yes, if we could just replace the ceramide sequelins and the intercellular lipids, things should be fine, right? So that is the reason. If you see right here, this is a representation of the skin, right? Stratum, corneum and epidermal cells which are there. Okay, and this is our moisturizer, ceramides. Okay, all right. So what is happening is, if we could just give enough moisturizer, if we could just give enough ceramides and sequelins on the skin, right, things could be manageable. So we could have a symptomatic management of this patient. Okay, all right, that is one thing. So in the treatment, what we would do is, we would ask the patient to apply moisturizer which contains ceramides. Okay, so the now next thing you're going to do is, you're just going to flip up your moisturizer and you will just see, okay, does my moisturizer have ceramides or not? Yes, definitely normal person can also should use the one actually which has these. Yes, it is good for our skin, it helps in proper collagen maintenance. Yes, okay, we can just replace the semen and things should be fine. But do you think you could replace these findings which are there in the skin? That is the histopathological finding. You see, this is just the word I ask you to remember, one of the many words that I ask you to remember, that is spongiosis, right? You see, now if we just add up the whole story once again, if you just see the histopathological image, these cells you see right here you see, these cells are these are the ones who have gone under spongiosis, right? Because of the intercellular edema, the whole mayhem is happening. All right, so that is the reason. If you understand this part right, yes, if you understand just this part right, and the analogy right, so we could never go wrong regarding the atopic dermatitis. Okay, so how do you think the presentation is going to be? So atopic dermatitis, yes, also called as eczema, Yes, this condition is a chronic inflammatory skin condition. Yes, in this we have pruritus, scaling, crusting, and at the end we have lichenification. This is a whole different process altogether. Lichenification. Alright, it happens at a very end stage, right, when the disease is progressed a lot and not managed properly. This is a very manageable condition. I'm pretty sure maybe we know at least one person who has it. Yes, okay, that is that. So this one point is very important. If you have listened to the revision series, we discuss a few things. Yes, I asked you some questions. Yes, and in that there was one question regarding this one point. Okay, what is that point? Okay, the question answer series. Yes, and in that I mentioned this thing. Yes, and eczema occurring before 5 years. Eczema occurring before 5 years is usually associated with asthma, and that is what I gave in the question, right? Asthma could have allergic rhinitis and food allergies. So these things along, yes, these things are usually associated with it. So if in the question I have given a young boy who is 4 years of age having history of asthma and I describe these, so the answer will be this. Okay, we can have a retrograde revision from the questions as well. Alright, fine, that is one point. And the presentation, yes, patients with classical eczema with relapsing and remitting red scaly crust. Yes, so as I told you that only we can manage the patient. There is only symptomatic management of this patient. Yes, there is not much of proper treatment. Yes, so we can only replace something which is deficient and not produce inside the keratinocytes. We cannot make the lamellar bodies to make them produce them, right? If there is some way, it's fabulous, right? It would be like game changing for it, for this specific condition, but for now there's not. So we just give the external ceramides, sequelins and the intercellular lipids, then it should be fine. Yes, so these are very quite relapsing conditions, right? Sometimes they would be perfect, sometimes it would be quite a lot. Yes, so lesions could be seen on the cheeks, face, flexural or extensa creases would be seen. So creases would be seen a lot in lichenification, right? In lichenification, so as you see in this image, so this is a very good image for the stage of lichenification, and very particularly the grooves which are there, right, are very deep as compared to these three images. This one has very clear, so the grooves are very deep, as you can see. This is the stage of lichenification. Okay, as you can also see in this photo, right, and over here you can see these cracks. Yes, in the hand eczema which is there, and even in the finger, right? So there is only some affected area, right? It is not like the whole hand or leg or the whole body is affected. Usually we have only on specific areas. Okay, all right, right over here you see, yes, it is very erythematous. Even on here, yes, in this hand you see, in this patient there are some dried out lesions, but this one is the biggest one. All right, so that is all about atopic dermatitis. A very small topic, but it is very important, yes, to know exactly the problem which is happening in the patient. So if you understood the analogy, I guess everything is pretty simple for us, right? Okay, thank you so much for listening.